Hello everybody and welcome to the Thursday edition of Video Clips. According to a new study, higher physical endurance and better lifestyle habits are associated with better working memory. And on the other hand, smoking, cannabis use, poor lifestyle habits, and overall poor physical health status are associated with suboptimal memory. So the healthier your body, the better your brain functions. Working memory is the ability to store, update, and use goal-relevant information and is the part of short-term memory that's associated with conscious perception and linguistic processing. Working memory supports other higher-order cognitive functions like problem-solving, learning, decision-making. Variation in working memory is influenced by a lot of factors that include gender. Women are, of course, smarter. I'm kidding, but age, education, personality traits, diet and lifestyle habits, and physical health. And we're going to focus on diet and lifestyle habits and physical health. Deficits in working memory contribute to neurological and psychiatric conditions such as mood and anxiety disorder and Alzheimer's disease. Well, the new study that I'm going to talk about today involved 823 healthy people between the ages of 22 and 37 years of age and used data from a project that gathers and distributes public research data on studies involving connections in the brain. The researchers reported that alcohol and binge drinking, regular smoking, higher blood pressure, blood glucose dysregulation, and higher body mass index were correlated with worse working memory network function. On the other hand, better physical endurance and sleep quality were associated with better working memory function and connectivity. They reported a very close association between healthier lifestyle habits and overall better physical health and cognitive ability, including whole brain functional connectivity. One of the reasons they wrote that this is the case was shown in a study performed by another research group. The study concluded that the brain is impacted by any factor that can influence blood oxygenation. Those factors include things like smoking, drinking, alcohol, weight status, diet, and exercise. The group cited other studies showing that increasing physical activity can improve working memory-related performance. According to lead researcher Sophia Franjou, simply put, this is a quote, "We might say that what's good for the heart is good for the brain since the variables we identified have cardiovascular consequences." She also said that since all the subjects were healthy, the study shows that a person doesn't have to be really sick in order for lifestyle factors to have a negative effect on brain function and memory. Now, I think that's a really important point that we should take just a second to think about. In other words, when we think about cognitive decline and Alzheimer's disease, we're thinking about people who are in their 70s and 80s and can't remember things. I think there are people in their 20s and 30s who aren't doing such a good job of that too. And the reason is that their bodies are not in very good shape, and that directly affects the function of their brain. She added that the researchers were surprised to find out how important physical endurance was in determining good working memory. Additionally, the findings are important for treating psychological conditions since the lifestyle habits and physical conditions that were found to influence memory are also common among psychiatric patients. She encouraged, quote, "An integrated physical and mental health approach is recommended for helping people with psychological conditions. The take-home point, the habits that prevent, stop, and reverse chronic disease also help to prevent, stop, and reverse cognitive degeneration." And really, this is not a discussion that we should just be having with older people. This is a discussion we need to be having with a lot of people. I have many people, and since I read this article, I've been paying attention to this more, who are in their 20s who say, "I can't remember anything. If I don't write it down, I can't remember it. I'm scatterbrained. I have brain fog." That seems to be a term. I try to do some research on brain fog, by the way, and there's no research on brain fog. It's sort of a made-up condition. And I think what brain fog really is I'm taking such terrible care of myself that not only is my body in bad shape, but my brain's not functioning very well either. So another reason to pay attention to eating well and exercising. Remember, physical endurance is important. You're not going to get physical endurance just by eating well. You get physical endurance by actually spending time in the gym, running, getting on that treadmill, and lifting weights and going to yoga and all that kind of thing. All right, so next let's talk about the BRCA gene mutation. I titled this article, "Much Ado About Nothing." Here's why. For many years, women have been told that having the BRCA1 or 2 gene mutations increased their risk of breast cancer. The risk was represented to be so high that women who had a family history of breast cancer have been advised to be tested to determine if they have the mutation, and if they do, to undergo prophylactic mastectomy and sometimes prophylactic oophorectomy, the ovaries taken out too. Over the years, I've cautioned women about this, since published studies have failed to show that that genetic testing and prophylactic mastectomy result in improved survival. Nonetheless, hundreds of thousands of women have had breasts and ovaries removed, and many of them were inspired by people like Angelina Jolie, who was willing to very publicly share her story about how she was a gene carrier and she had her breasts removed and her ovaries removed. And I've written a lot about this topic. There are several articles published in the Health Briefs library if you are a subscriber. And I think Jolie was trying to be helpful, but I don't think she really realized inadvertently she was misleading a lot of women. Well, a new study confirms the fact that women who have the gene mutations do not have a higher risk of dying of breast cancer. The study included 2,733 women between the ages of 18 and 40 who were treated for invasive breast cancer at 127 centers in the UK. Survival at 2, 5, and 10-year periods was about the same for women who did and did not have the mutation, meaning that the gene mutation did not increase the risk of death from breast cancer. About 1/3 of the women with the mutation had bilateral mastectomy, which also did not improve their survival odds at 10 years. Women with triple-negative breast cancer who had the gene mutation actually appeared to have a survival advantage during the first few years of follow-up. The findings did not vary after adjusting for ethnicity and body mass index. The researchers noted that previous studies have shown that gene mutation carriers with ovarian cancer have a similar early survival advantage. They reported that while prophylactic removal of the ovaries does reduce the risk of ovarian cancer, they noted that studies showing that oophorectomy resulted in a lower risk of breast cancer for gene carriers overestimated the benefits due to poor study design. Researchers reported that prior to beginning this study that I'm covering right now, they looked at previous studies and found that the results were inconsistent, with some studies showing that outcomes were better, worse, or exactly the same for women with mutations versus those who did not. They stated that the conflicting results were most likely a result of extreme bias in some of the studies that involved selective identification of cases, incomplete genetic testing, small sample sizes, failure to adjust for variables such as treatment, and short duration of follow-up. Stating that theirs is the largest prospective cohort study to date that has compared outcomes between carriers and non-carriers, they concluded, quote, "We found no clear evidence that either BRCA1 or BRCA2 germline mutations significantly affect overall survival with breast cancer after adjusting for known prognostic factors. Decisions about timing of risk-reducing surgery should take into account primary tumor prognosis and patient preference. BRCA mutation carriers presenting with triple-negative breast cancer may have an improved survival during the first few years after diagnosis compared with non-carriers, although immediate bilateral mastectomy did not account for this advantage." They went on to advise that in light of this information, clinicians should discuss benefits and risks of mastectomy with their patients. More and more we're seeing articles like this, first of all, that counteract the common wisdom. Everybody knows that gene carriers are at higher risk of dying from breast cancer. They are clearly not, and this is not the only study. As I mentioned, I've written about this issue considerably over the last few years, and there are articles in the Health Briefs library that you can read about this if you want to look into it further. But the other thing is more and more research articles and studies that I'm reading about in medical journals, the conclusions often involve advice that patients should be fully informed. Clinicians should make the effort to make sure that the patients are fully informed and that sort of thing. I don't think that clinicians are making a great effort to make sure that patients are fully informed in general. There are some exceptions out there. But the consumer has got to take responsibility until things really shift of being fully informed and getting this information on their own. That's what we do here, is provide it. Because I would think that the hundreds of thousands of women who had their breasts removed would probably like to have known this before they did that. All right. So anyway, the thing, it's like a mantra around here. Consumers must be informed. They must take responsibility for getting information on the risks and benefits of doing anything that involves diet, supplements, diagnostic or screening tests, procedures, and taking drugs before they make a decision. The exception, of course, would be some type of emergency treatment that would be required. But in the absence of emergency, get information first before you decide what you're going to do. All right, that's all for today and all for the week. So please feel free to pass this on to anybody who you think might enjoy watching it. I'll be back to you next Tuesday with more news.